The Brazilian buttock enhancement procedure has become one of the most popular procedures performed in my practice today. It's got very little downtime and there's very little pain associated with the procedure itself. Virtually anyone is a candidate for the procedure except for those patients that just don't have enough fat to be transferred to the buttocks to afford a significant enough enhancement. And in that situation we can look to other areas for donation of the fat. Those other areas usually involve either the upper arms or the thighs circumferentially, or the saddlebag area or the outer thigh region. There is a secondary benefit to the procedure, and that's the liposuction that occurs for harvesting of the fat that's going to be transferred. And that liposuction is usually done circumferentially around the waist and the trunk to tighten down the waistline and give sort of an illusionary effect of buttock enhancement. That, coupled with the fat then transferred and injected into the buttocks, provides an even nicer result. Essentially, the patients are back on their feet the same day. There's a small amount of pain associated with it, and mostly due to the liposuctioned areas, which are sore for 3 to 5 days. There are some compression type garments that need to be worn for a couple of weeks, and I inhibit my patients from sitting directly on their buttocks for a full 2 weeks. Now, the myth is that you can't sit at all for those 2 weeks, and that is essentially a myth because there are ways of sitting without directly applying pressure to the area that's been treated. Another myth that's out there on the internet is that the fat doesn't last. In my practice, I'm achieving about an 80% retention rate of the fat, meaning that 80% of what's transferred into the buttock survives and stays there permanently throughout the rest of the patient's life, and provides them with a significant improvement and enhancement in their body contours for many years to come.